Welcome to a first-of-its-kind publicly held AI-generated interactive holographic breast health awareness lecture by Dr. Raghu Ram.
Pleasure to be a part of this world record attempt. Today marks truly a historic occasion, one that brings together the power of technology, the spirit of compassion, and an unwavering commitment to women's health. We are gathered here to witness not one, but multiple landmark milestones in breast health awareness. First of its kind, AI-generated interactive holographic lecture delivered by Dr. Raghu Ram, an official attempt for the largest audience for an interactive AI-enabled holographic health awareness lecture. Girls, are you all excited to be part of this world record event?
Yes.
Absolutely. Is it your first time?
Yes.
And I'm feeling so proud. And for all the girls present here today, we are not just participants in this attempt, in this world record attempt. We are the future scientists, entrepreneurs, doctors, artists, leaders, and change makers of our nation. Technology you see today is a glimpse of the future, But our dreams and determination are what will truly shape that future. Thank you so much for being part of this wonderful event. And I take the pleasure to welcome all the dignitaries. And may I call upon Dr. Bhaskar Rao Garu to please join us for the lighting of the lamp. And I also welcome our chief guest, Dr. Abhijat Sethji, and our special invitees, Padma Shri Garu, Dr. Ananda Shankar Garu, and Dr. Mallikarjuna Garu and Dr. Raghu Ram Garu to please join us on stage to light the auspicious ceremonial lamp to begin the proceedings. Gangadhar Garni Kuda, request you to please join us on stage, sir.
Mrityorma amritam gamaya sarvesham swastir bhavatu sarvesham shantir bhavatu sarvesham purnam bhavatu sarvesham mangalam bhavatu loka samasta sukhino bhavantu. Om Shanti Shanti Shanti.
Sukhino Bhavantu. Thank you, sir. Thank you very much. On that note, may I request Dr. Raghu Ram Garu to welcome the gathering and take it forward.
Namaskaram. To have Dr. Abhijat Seth, who is the chairman of the National Medical Commission and the president of the National Board of Examinations in Medicine. You can't get any higher than that in our medical profession. He represents our profession in this country. He represents and shapes the healthcare education in this country. Sir, your presence here has added tremendous prestige to this occasion. And he has created time to come here despite his hectic meetings and an upcoming international travel. And that speaks volumes about his commitment to attend this program. Very grateful, sir. Equally delighted and honored to have three distinguished special invitees who represent different walks of life. Shri Padma Shri Garu, a Padma Bhushan awardee who has spent his lifetime in public service and building the nation. Dr. Ananda Shankar Jayant, an internationally renowned classical dancer, a Padma Shri awardee and a Sangeet Natak Academy awardee, and also a breast cancer conqueror, and I've been fortunate to be involved in her care. And we have one of our own, Dr. Mallikarjuna, an internationally renowned urologist, the chairman of AINU, and the vice president of the National Board of Examinations in Medicine. A warm welcome to all of you who have come from, mainly of course, we have so many young enthusiastic students. So a very warm welcome to all of you, and most importantly, to some of my patients who have created the time to come here, and also to my colleagues from different disciplines who are here today. Today is a very special day. Over the past 2 decades, the Ushalakshmi Breast Cancer Foundation and KIMS-USHALAKSHMI Centre for Breast Diseases has left no stone unturned in our mission to create the much needed awareness about the importance of early detection of breast cancer, and equally stands shoulder to shoulder with breast cancer conquerors who have fought the disease. Today, we are taking that mission forward by bringing together medicine, artificial intelligence, and immersive technology under one platform. What you're going to witness today is a world's first of its kind, artificial intelligence enabled holographic version of me that delivers a talk for 32 minutes and 50 seconds on various aspects of breast health. Traditionally, any cancer awareness event focuses only on cancer. But as some of you will be aware here, 9 out of 10 breast health issues are benign. They are not cancers. What they need is to be reassured. Reassuring the worried well is an important component of delivering an effective breast health care service. So the first 15 minutes of this talk focuses on benign breast diseases, and the remaining 15 minutes focuses on some of the common myths associated with breast cancer and broad principles of management of breast cancer. So, in addition to this, we will be launching a nationwide Digital India campaign for breast health. We have termed this NARI, National Awareness and Resource Initiative for Breast Health. Through an artificial intelligence enabled digital avatar of me with my face and my name, at the click of a button, anyone, anywhere in this world can get access to credible information relating to every aspect of breast health. Ladies and gentlemen, technology alone does not save lives. What saves lives is knowledge, awareness, and timely treatment. Our goal and our mission is laser sharp, and that is to democratize access to credible breast health information, reduce fear and stigma, ensure early detection, and support breast cancer, we call them conquerors, in the fight against the most common cancer affecting women in our country. So I once again, with folded hands, express my gratitude to all of you for coming here, to all the enablers of this technology, to Mr. Mani Shankar, who is considered to be the godfather of holography in this country and beyond, his children, Bhairav, Prem, and their team, who have done an incredible job to pull this off. And equally to Ravi Kiran and Kaushik from Vaira, which is an artificial intelligence company, who have actually pulled all stops to make the NARI successful launch later today. So I now request Bhargavi to take forward the proceedings and invite our educator onto stage. Thank you.
Thank you very much, Dr. Raghu Ram garu. We're about to begin with the first landmark event of the breast health awareness and the first of all AI-enabled landmark initiative. To give us the instructions, may I call upon Mr. Swapnil Tangarikar, educator, and please come forward and explain us the rules and regulations before we begin.
Good morning, everyone. This is now going to be the official Guinness World Record attempt for the largest audience for an interactive AI-enabled holographic health awareness lecture. This is the first time in the world that this kind of a record attempt is happening. So all of you are in a way lucky and privileged to be a part of something that is such a new concept, because it's bringing together cutting-edge technology and health awareness into one platform. So we have set a minimum requirement of 250 participants, who all of you are here as audience to listen to this lecture. At the gate count, I have more than 426 people counted already. So you have cleared the first stage to qualify for the record. Now, the next part, the onus is upon all of you as viewers. All of you have to listen to the lecture. Any activity which is not listening, which could involve playing on your phone, somebody who wants to leave for any reason at all, will automatically get disqualified. There are observers here and that side who are looking at a smaller group of participants. So if anybody needs to leave or is not paying attention, we will just know, and we will only be counting the people who are successful as listeners and as audience. Okay. The lesson has to go on for minimum 30 minutes, and there will be an Q&A, an interactive session, which has to last for minimum of 10 minutes. All of that, I'm sure, has already been taken care of. I've had a lengthy discussion with Dr. Raghu Ram on all of these topics, and I'm very happy to be present here. And let me just say all the best to all of you, and we can start with the official attempt. Thank you.
The first AI-generated holographic educator, Dr. P. Raghu Ram Garu, will now address on the breast health awareness.
Namaskaram. Welcome to this unique, exciting and pioneering first of its kind breast health awareness session delivered through an artificial intelligence enabled interactive holographic version of me. Importantly, today's session is not only about breast cancer, it's also about benign, non-cancer breast health issues which are far more common than breast cancer. The session represents an important step towards responsibly integrating medicine, artificial intelligence, and immersive technology to empower people with trusted, evidence-based information about every aspect of breast health explained in a simple, easy to understand format. Everything begins with a story. My real story began when my mother was diagnosed with breast cancer in 2002. Dr. Ushalakshmi was a renowned gynecologist and a gritty breast cancer conqueror who inspired the implementation of an impactful breast cancer advocacy movement and a robust population-based breast cancer screening program in the southern Indian states of Telangana and Andhra Pradesh. This presentation is dedicated to the memory of my mother, whose indomitable spirit continues to inspire my life's mission. The aims of my presentation are essentially fivefold. Firstly, to highlight benign non-cancer breast health issues, which, as I said earlier, is far more common than breast cancer. Secondly, to touch upon the incidence, mortality, causes and risk factors for breast cancer. Thirdly, to demystify some of the common myths associated with benign breast disease and breast cancer. Fourthly, to address issues around diagnosis, counseling and treatment options for breast cancer. And finally, to emphasize the importance of screening in ensuring early detection. When a woman notices a lump in the breast, it is but natural for her to be anxious about the word breast cancer. But the good news is, 9 out of 10 breast lumps are not cancers. The vast majority of breast health issues are not related to cancer. How does one know whether the lump in the breast is benign or a breast cancer? It is by a process called triple assessment. Who does the triple assessment? It is done by a surgeon, a radiologist, and a pathologist. Just as a physician needs a stethoscope to diagnose a condition, for a surgeon practicing breast disease, the eyes and ears are a good radiologist and a good pathologist. What are the components of the triple assessment? The first component is taking a good history and clinical breast examination by a specialist. The second component is a combination of mammogram which is an X-ray of the breast and ultrasound scan. And the third component of the triple assessment is a biopsy, a core needle biopsy, which is the standard of care. Now let us look at some of the common benign breast health issues. Breast pain is the commonest symptom experienced by women of all ages. It can be cyclical breast pain, which occurs in younger women, which is worse before the periods and gets better after the periods. It is usually bilateral. Non-cyclical breast pain is unrelated to the periods. There is no specific cause, but sometimes can be caused by injury to the breast, previous surgery to the breast, or a benign breast lump which is causing pain, or it could be because of stress as well. This is usually unilateral. And the third, which is often branded as breast pain but which is not breast pain, is chest wall pain, which is different from breast pain, and this occurs due to inflammation in the costal cartilages and in the joint space between the sternum, that is the central bone, and where the ribs emerge, which is called costochondritis. A careful triple assessment and clinical breast examination will definitely identify those women who have breast pain versus those who have chest wall pain. When the triple assessment is done and it does not show any abnormality, the treatment is essentially reassurance, reassurance and reassurance. Wearing a correct fitting bra and indeed relaxation therapy, because breast pain can also occur because of stress. Relaxation therapy such as meditation does help. Sometimes when the pain is quite severe, under the supervision of a doctor, a short course of paracetamol or non-steroidal anti-inflammatory drug gel can be locally applied, but only under the supervision of a doctor. Sometimes changing an oral pill to mechanical contraception helps, and on some occasions tamoxifen, which is a drug given for breast cancer treatment, which is an anti-estrogen tablet, is given for a short period of time. For chest wall pain, sometimes when it is very severe, injection of a local anesthetic with or without a steroid can help. But essentially, the main treatment is reassurance. What I'd like to also emphasize that vitamin E, evening primrose oil or danazol, antibiotics or diuretics have absolutely no place in treatment of breast pain. Fibroadenoma. This is the most common benign breast lump. It occurs in younger age group and presents as a painless lump in the breast and feels like a smooth, freely mobile lump in the breast. It is often referred to as breast mouse. As I said earlier, triple assessment will confirm the diagnosis. It is a myth that the vast majority of fibroadenomas require surgery or excision. The fact remains that the vast majority of fibroadenomas do not need removal. The vast majority of fibroadenomas are between 1 to 3 centimeters. They are referred to as simple fibroadenomas. All that is needed to be done is reassurance and bringing them back, the patient back in a few months' time to do an ultrasound scan to check whether or not the size is increasing. There is an entity called complex fibroadenoma, which is diagnosed on core needle biopsy. This complex fibroadenoma is rarely associated with a cancer, and for this reason, when a diagnosis of complex fibroadenoma is made, the advice or the treatment would be an excision. Sometimes when the fibroadenoma is very large, over 5 centimeters, it is referred to as a giant fibroadenoma. In such circumstances as well, excision is advised. In a lump between 1 to 3 centimeters in size, unless the patient is very keen to get it excised, we can reassure the patient and bring them back and manage this patient conservatively. The third common benign breast health issue is a breast cyst. This occurs in women over the age of 30 and in perimenopausal age group. It presents as a sudden onset of noticing a lump in the breast. It's almost dramatic, and the patient typically says, I've noticed the lump yesterday and I've come to you today. So this lump most often is painless. A painful cyst sometimes can present, that is, there can be features suggestive of infection. So a triple assessment, which includes a mammogram and an ultrasound scan, confirms the diagnosis. Most often, when the cyst is not accompanied by pain, there is absolutely no role for doing an ultrasound guided aspiration because it serves no purpose. Ultrasound guided aspiration of the cyst is only done when the cyst is painful or is infected. And also I would like to point out that if it's just a simple cyst and the fluid is withdrawn, there is absolutely no need to send it for any cytology, as once again it doesn't serve any purpose. As women age, the ducts behind the nipple grow shorter and wider. This is referred to as ductectasia. It usually occurs in older women and they present usually with nipple retraction, nipple discharge, which could be greenish, yellowish, brownish or dark. When the triple assessment is done and there is no underlying pathology, all that is required is to reassure the patient and follow up. There is, however, another condition that is closely associated with ductectasia is periductal mastitis, which is infection of the tissue around the ducts. The ducts under the nipple become inflamed and infected. It usually affects younger women, particularly those who smoke, and also lactating women. There is discharge from the nipple, there could be redness around the nipple areolar region, and there is pain, sometimes fever, and sometimes nipple inversion. What is required is prompt recognition, early institution of antibiotics, and if there is an infection, then a needle is passed into that area and fluid is removed so that the abscess can be drained. In this day and age, when there is an abscess in the breast, there is no role for upfront incision and drainage. That is an operation to remove the pus from the abscess cavity. In this day and age, the first option is to do an ultrasound guided aspiration of the infected area, and the patient may need to be brought back for repeated aspirations, closely followed up with antibiotics, and to see whether the infection is responding. If the infection does not respond to repeated aspirations, only then is incision and drainage recommended. Benign breast health issue which I'd like to highlight is about benign calcifications in the breast, which is extremely common in women who undergo screening mammogram over the age of 40. They are unrelated to intake of calcium in the diet. They are very normal result of aging, sometimes injury and previous surgery to the breast. Absolutely nothing to be worried about. There is no treatment required nor any follow-up. The second aim of my presentation is to touch upon the incidence, mortality, Causes and risk factors for breast cancer. Breast cancer is a tsunami with over 200,000 new cases being diagnosed every year. It has replaced cervical cancer to become the commonest cancer affecting women in India. Every 4 minutes, a woman is diagnosed with breast cancer in our country. With 100,000 deaths per annum, India loses a staggering number of women to this disease that can be treated effectively if caught early. Unfortunately, every 8 minutes, a woman succumbs to breast cancer in our country. For every 2 women who are diagnosed with breast cancer, 1 succumbs to breast cancer. Due to lack of awareness, absence of a robust population-based screening program and inequitable care, more than 60% present in the advanced stages, and this is the primary reason for high mortality rate in our country. The breast has got ducts, multiple ducts and lobules, and in between the ducts there is fatty tissue. When the cancer occurs within the ducts, it is referred to as ductal carcinoma. It is the most common form of cancer. When the cancer occurs in the lobules, it is referred to as lobular carcinoma. In addition, there are certain special types of cancers such as inflammatory cancer, which is an aggressive form of cancer, Paget's disease of the nipple, which is cancer occurring in the nipple areolar region, and thirdly, a phylloides, a malignant phylloides tumor. What causes breast cancer? Breast cancer occurs when cells within the breast begin to divide and grow in an unusual and uncontrolled way. Any factor that increases the exposure of the hormone estrogen for a prolonged period of time on the breast can potentially cause breast cancer. What are the risk factors? The 2 biggest risk factors are being a woman and previous history of breast cancer. The other risk factors include early menarche under the age of 12 years or late menopause after the age of 55 years, both of which allow uninterrupted prolonged action of the estrogen on the breast. Apart from these risk factors, lifestyle changes like late marriages, not having children, having the first child after 30, not breastfeeding, and obesity, particularly after menopause, because after menopause, even fat cells can produce estrogen and can potentially cause breast cancer. And in addition to these risk factors, there are other risk factors which include a strong family history of breast cancer, which constitute 5 to 10% of breast cancers. The third aim of my presentation is to demystify some of the common myths associated with benign breast disease and indeed breast cancer. There is a myth that breast cancer only occurs in older women. Although the incidence of breast cancer increases as women age, in our country, the peak incidence of breast cancer is in younger women between the ages of 40 to 50 years, at least a decade earlier than in the Western population. There is a myth that family history is the most important risk factor. The fact is, family history is not the most important risk factor. A strong family history which involves mutation, that is abnormalities in the BRCA1 and BRCA2 genes, can potentially cause breast cancer. But who is at risk? What constitutes strong family history? When 1 or more close relatives have been diagnosed with breast cancer under the age of 40 years, or 2 or more close relatives who have been diagnosed with breast cancer at any age, or close relatives who have been diagnosed with breast cancer and others who have been diagnosed with ovarian cancer, or a male member within the family who has been affected with breast cancer. When this kind of pattern is there, then one can suspect that they are likely to carry abnormalities in BRCA1 and BRCA2 genes. Therefore, counseling is absolutely crucial before genetic testing is done to anyone with a strong family history of breast cancer. It is a myth that injury to the breast can cause breast cancer. Injury to the breast does not cause breast cancer. It is a myth that wearing an underwire bra can cause breast cancer. The fact is, there is absolutely no scientific evidence to suggest that underwire bra or a tight bra can cause breast cancer. It is a myth that deodorants or antiperspirants can cause breast cancer. The fact is, there is absolutely no evidence in that statement. It is a myth that men don't get breast cancer. Men also can get breast cancer, but it is rare. If 100 breast cancers are diagnosed, 99 will be in women and only 1 will be in a man. Can hormone replacement therapy cause breast cancer? Prolonged use of combined hormone replacement therapy with estrogen and progesterone poses a modestly increased risk of breast cancer. The risk reduces when the hormone replacement therapy is stopped. It is therefore important to discuss with your gynecologist and a surgeon treating breast disease before commencing hormone replacement therapy. But I would like to emphasize that women who have previously been diagnosed with breast cancer and those who carry BRCA1 and BRCA2 abnormalities should not take hormone replacement therapy. Does birth control pill cause breast cancer? In the days gone by, the oral pills contained high dose of estrogen, which posed an increased risk of breast cancer. In this day and age, the dose of estrogen within the pill is very low and the risk of developing breast cancer is very, very less. There is a myth that pregnant women do not get breast cancer. Pregnant women also can get breast cancer, and in fact, in pregnancy, the breasts are very lumpy, so it's very difficult to pick up a lump, and women must be very vigilant, and any new persistent change must not be ignored. It's a myth that breastfeeding prevents breast cancer. The fact remains that breastfeeding certainly significantly reduces the risk of developing breast cancer. It is a myth that breast self-examination is no different from breast awareness. Ladies and gentlemen, there is a vast difference between breast self-examination and breast awareness. Breast self-examination is a repetitive, regular, monthly examination of the breast to a set method by the woman every month. Whereas breast awareness is about becoming familiar with the breasts and the way they change throughout the woman's life. It is a concept that encourages women to know how their breasts look and feel throughout the month rather than at one particular time during the month. Whether during having a shower or whilst applying a cream on a daily basis, women are encouraged to know what changes to look for. This is referred to as breast awareness, and as a concept is gaining increasing acceptance worldwide. What changes should women be aware about? Firstly, is there any lump in the breast, particularly a painless lump in the breast? Secondly, is there any change in the size of the breast, shape of the breast? Thirdly, is there any puckering of the skin overlying the breast? Fourthly, is there any change in the color of the breast, like redness, for example? Fifthly, is there any recent changes to the nipple, particularly retraction of the nipple? Sixthly, is there any rash or crusting around the nipple areolar region? And seventhly, is there any blood-stained nipple discharge? If any of these features are there, one must not panic but must report to a specialist without any delay. The fourth component of my presentation is relating to diagnosis, counseling and treatment. How is breast cancer diagnosed? Just as I have mentioned when I spoke about benign breast disease, triple assessment, that is a history and clinical breast examination, mammogram and ultrasound scan, and a core needle biopsy and not a fine needle aspiration cytology is the gold standard to detect breast cancer, which is done by a surgeon, a radiologist and a pathologist. After diagnosis, before instituting treatment, counseling patients and their relatives is of paramount importance. Why? Because cancer does not just affect the body, it affects the body, mind and soul, and treating just the physical body isn't enough. In fact, counseling comprises of 50% of cancer care, and it involves explaining about the condition in simple, easy to understand format, perhaps more than once or twice, and giving the much needed confidence to the patient to deal with this unwelcome visitor in her life. After diagnosis and staging and indeed counseling, the next component would be treatment. The treatment is decided by a multidisciplinary team which involves the surgeon, the radiologist, the pathologist, the medical oncologist, the radiation oncologist, the breast care nurse, and sometimes the palliative care specialist. It is always personalized and there are essentially 5 modalities of treatment. The first is surgery to the breast, the second is chemotherapy, third is radiotherapy, fourth is hormone therapy, which is a tablet therapy, and fifth is a targeted therapy. Which treatment is given to which patient is decided by the multidisciplinary team, and therefore the treatment is very personalized. The fifth component of my presentation is to touch upon breast cancer prevention and screening. Can breast cancer be prevented? Although strictly speaking, we cannot prevent breast cancer, but adopting several lifestyle changes can significantly reduce the risk of breast cancer by about 20 to 30%. A healthy diet, regular physical aerobic exercise at least 30 minutes each day, avoiding smoking entirely, minimizing the intake of alcohol, and breastfeeding is very protective and significantly reduces the risk of developing breast cancer. Coming to screening, I am asked this very important question by a number of women, and the question is, Doctor, I have no lump. Why are you asking me to get a mammogram? The answer is, a screening mammogram detects breast cancer many years before the lady or the doctor can feel the lump in the breast, thus significantly improving survival. Why have breast screening? Breast screening can help to detect small subtle changes in the breast before they show up, many years before the doctor or the lady can feel the lump. And early detection of breast cancer offers the best chance of successful treatment, which significantly improves the women's chance of survival. So, if you are 40 and over, you must get an annual screening mammogram. There is a myth that breast screening by way of mammography can prevent breast cancer. Mammography or screening mammography cannot prevent breast cancer, but it helps to detect cancer at a very early stage. There is another common myth that mammography is 100% accurate in detecting breast cancer. The fact is, mammograms are the most efficient way of detecting breast cancer very, very early. Like other screening tools, they may not be perfect, so the accuracy is around 85%. There are two reasons why women hesitate to go for a screening mammogram. Firstly, they think that mammography induces radiation hazard. The fact is, in this day and age of digital mammography and 3D mammography, the radiation risk from a mammography is very small, very tiny, equivalent to the radiation delivered through a chest X-ray. The second reason why women hesitate to go for a mammography is because they think it causes a lot of pain. The fact is, it should not be painful if it is done properly, and again, with digital mammography and 3D mammography, the discomfort is much less and is only momentary. One of the high points in my career has been the distinct privilege and honor of meeting our Honorable Prime Minister Shri Narendra Modi ji and spending 20 minutes with him discussing various strategies to improve breast cancer care in our country. In a deeply encouraging gesture, our Honorable Prime Minister not only autographed the inaugural issue of Pink Connection, which is our foundation's flagship breast health magazine, he also publicly commended Ushalakshmi Breast Cancer Foundation in the X platform, which has greatly strengthened our mission. So in conclusion, ladies and gentlemen, benign non-cancer breast health issues are far more common cancer. Triple assessment accurately distinguishes a benign lesion from cancer. Most benign breast health issues can be managed conservatively. The primary responsibility of our health lies with us, not with someone else, but with us. Early detection of breast cancer saves lives. So if you are 40 and over, please schedule to have an annual screening mammogram. Traditionally, women in India prioritize the needs of their family first, neglecting their own health. We must not forget that the woman is the nerve center for our family. If she is well, the family thrives. If she is not well, the family will not be well. And therefore, it is the bounden duty for the men in the household to ensure that the women in their lives, whether it's their mother, spouse, grandmother, sister, aunt or a relative, get an annual screening mammogram from the age of 40 every year. We have a number of festivals. Instead of gifting a sari or sweets, or in addition to gifting a sari and sweets, it is our duty to gift the women in our lives an annual screening mammogram. On this landmark day, ladies and gentlemen, it is my dream that every woman in Bharat, irrespective of where she lives, has access to timely breast health screening and life-saving opportunity of early detection. Samasta Loka Sukhino Bhavantu. Jai Hind. I would like to express my heartfelt gratitude to everyone here today for having attended this presentation. The artificial intelligence-enabled holographic version of me will be happy to take questions from the audience in Hindi, English and Tamil. Patient hearing, and this is one part of course, a record, but I'm very happy that through this holographic representation of me. To share general information about. So there are some people who wanted to ask questions. Can you please come here? You need to ask the question. Who is coming? Madam, you have to come here. In English, Hindi and Tamil, we are developing other versions as we speak. Where are the students who had questions? Please come here. Lights on, please. You have to come.
How about screening?
1 minute.
How about screening of the woman after treatment? And how about recurrent breast cancer?
It seems that is outside what I am here to talk about. Is there something about breast health or breast cancer awareness I can help you with? One question.
Yeah. How about screening after treatment?
Screening after treatment is important for monitoring your health and ensuring any potential recurrence is detected early. Generally, after breast cancer treatment, healthcare providers recommend a follow-up plan which often includes regular clinical breast examinations and mammograms. Usually, women are advised to have a mammogram every year after completing treatment, but the specific schedule can vary based on individual circumstances. Your doctor will guide you regarding the right follow-up plan tailored to your history and treatment. Always report any new changes or concerns promptly.
Is the nipple discharge normal?
Nipple discharge can have different causes, and while it is often not a sign of cancer, it's important to pay attention to any new or unusual discharge. Normal causes may include hormonal changes, cysts, or conditions like ductectasia, which are generally benign. However, if the discharge is persistent, bloody, or coming from one nipple, it should be evaluated by a qualified doctor. Always report any new changes to your healthcare provider for proper assessment and guidance.
When should nipple discharge be cause for concern?
Nipple discharge should be a cause for concern if it meets any of the following criteria. First, if it is new or unusual compared to what is normal for you. Second, if the discharge is blood-stained or clear fluid from one nipple. Third, if it is accompanied by other symptoms such as redness, warmth, or a lump in the breast. If you notice any of these changes, it's important to consult a qualified doctor for further evaluation. Early assessment helps ensure that any potential issues are addressed promptly.
Does bloody nipple discharge always cause cancer?
No bloody nipple discharge does not always mean cancer. There are several possible causes for bloody discharge, including benign conditions such as ductectasia, intraductal papillomas, small benign growths in the ducts, or hormonal changes. However, any new or unusual discharge, especially if it's bloody, should be evaluated by a qualified doctor to determine the cause. Early checkups are essential to ensure proper assessment and peace of mind.
Can fibrocystic changes increase the risk of breast cancer?
Fibrocystic changes in the breast are quite common and typically do not increase the risk of breast cancer. These changes usually include lumpy and tender areas in the breast, often linked to hormonal fluctuations throughout the menstrual cycle. However, some specific changes associated with fibrocystic conditions like atypical hyperplasia can slightly raise the risk of breast cancer. It's important for individuals with fibrocystic changes to be aware of their breasts and report any new or unusual changes to a qualified doctor. Regular screenings and understanding what's normal for you are key to maintaining breast health.
Can breast infection occur in women who are not breastfeeding?
Yes, breast infections can occur in women who are not breastfeeding. While infections like mastitis are common during breastfeeding, non-lactational breast infections can also happen. These infections may result from blocked ducts, skin infections, or other factors. Symptoms can include redness, swelling, warmth, and pain in the breast. If a woman experiences these signs, it's essential to see a qualified doctor for proper evaluation and treatment. Prompt attention helps prevent complications and ensures better recovery.
What are the common breast lumps in young women?
In young women, common breast lumps are often benign and include two primary types. First, fibroadenomas, which are smooth, firm and movable lumps. They are usually painless and can vary in size. These lumps are quite common in women in their teens and 20s. Second, cysts, which are fluid-filled sacs that can develop in the breast tissue. They can feel like rounded lumps and may change in size with the menstrual cycle. Both of these types of lumps are generally not cancerous, but any new breast lump should always be checked by a qualified doctor for proper evaluation and richness. Early assessment is important to rule out any serious conditions.
Good morning, sir. If scan show a lump is benign, do I still need follow-up?
Yes, even if a scan shows that a lump is benign, follow-up is still important. Your doctor may recommend regular monitoring and follow-up imaging or clinical examinations to ensure that there are no changes over time. Breast can undergo changes, and having a follow-up plan helps you stay aware of your breast health. Always report any new changes or concerns to your healthcare provider, as early detection and consistent monitoring are key to maintaining breast health.
Does breast pain usually means cancer?
No, breast pain does not usually mean cancer. In fact, breast pain is very common and often linked to benign conditions rather than cancer. It can be caused by hormonal changes, cysts, fibrocystic changes.
Hindi, anybody?
Strain. Breast pain is generally categorized into two types: cyclical, which often relates to the menstrual cycle, and non-cyclical, which can be due to other factors. While breast pain on its own is rarely associated with cancer, it is important to consult a qualified doctor if the pain is persistent or accompanied by other changes in the breast. They can provide a proper evaluation and peace of mind.
क्या निपल से होने वाली सभी डिस्चार्ज को जांचना चाहिए, जांच करवानी चाहिए?
जी हाँ, निप्पल से होने वाली सभी डिस्चार्ज को जांचना चाहिए, खासकर यदि ये नई या असामान्य हो। कुछ कारणों से निप्पल से डिस्चार्ज होना आम है, जैसे हार्मोनल बदलाव, सिस्ट या डक्ट एक्टेसिया। हालांकि यदि डिस्चार्ज खून से रंगा हुआ हो या एक निप्पल से हो, तो यह और भी महत्वपूर्ण है कि इसे तुरंत एक योग्य डॉक्टर द्वारा जांचा जाए। सही समय पर जांच करवाने से समस्या का समुचित समाधान हो सकता है।
क्या ब्रेस्ट की हर लंप कैंसर होती है?
जी हाँ, ब्रेस्ट कैंसर एक ऐसी स्थिति है जहां स्तन की कोशिकाएं अनियंत्रित रूप से बढ़ने लगती हैं। ये महिलाओं में सबसे आम कैंसर है, लेकिन ये पुरुषों में भी हो सकता है। हालांकि ये काफी दुर्लभ है। आधुनिक चिकित्सा में विभिन्न प्रकार के ब्रेस्ट कैंसर शामिल होते हैं, जैसे कि इन्वेसिव डक्ट कैंसर, इन्वेसिव लोबुलर कैंसर और डक्ट कार्सिनोमा इन साइटू DCIS। ब्रेस्ट कैंसर का जोखिम कई कारकों पर निर्भर करता है, जैसे उम्र, परिवार का इतिहास, आनुवंशिकता, जीवन शैली आदि। यदि आपको ब्रेस्ट कैंसर के लक्षण जैसे नई गांठ, आकार में परिवर्तन या निप्पल से असामान्य डिस्चार्ज दिखें, तो आपको तुरंत डॉक्टर से संपर्क करना चाहिए। समय पर जांच और उपचार से ब्रेस्ट कैंसर के परिणाम बेहतर हो सकते हैं।
महिलाएं प्राकृतिक रूप से अपनी स्तन के दर्द को कैसे कम कर सकती है?
महिलाएं प्राकृतिक रूप से अपने स्तन के दर्द को कम करने के लिए निम्नलिखित उपाय कर सकती हैं। पहला, एक सही फिट की ब्रा पहने जो स्तनों को सपोर्ट करे और आरामदायक हो। दूसरा, तनाव कम करने के लिए योग और ध्यान जैसी तकनीकों का उपयोग करें, क्योंकि तनाव से भी स्तन का दर्द बढ़ सकता है। तीसरा, कैफीन का सेवन कम करें, क्योंकि कुछ महिलाओं में ये दर्द को बढ़ा सकता है। चौथा, एक गर्म या ठंडी कंप्रेस का प्रयोग करें, क्योंकि ये दर्द को कम करने में मदद कर सकता है। इसके अलावा नियमित व्यायाम और संतुलित आहार भी समग्र स्वास्थ्य को सुधारने में सहायक होते हैं। यदि दर्द पर्सिस्टेंट या गंभीर हो तो डॉक्टर से जांच कराना महत्वपूर्ण है।
மன அழுத்தம் மார்பக வலியை மோசமாக முடியுமா?
மன்னிக்கவும், ஆனால் நான் உதவ முடியாத வார்த்தைகள் அல்லது விவரங்களை தரவில்லை. எனவே நீங்கள் என்னிடம் பரிசீலனை செய்ய விரும்பிய விஷயங்களை அல்லது மருத்துவ நடவடிக்கைகளை பற்றி கேளுங்கள்.
மார்பகத்தில் ஏற்படும் என்னென்ன மாற்றங்களை ஒருபோதும் புறக்கணிக்க கூடாது?
Please ask loudly. மாறாக மார்பகத்தில் ஏற்படும் எந்த ஒரு புதிய அல்லது அடிக்கடி மாற்றங்களை படித்தல் அவசியமானது. இந்த மாற்றங்கள் உதாரணமாக புதிய உள்குழல் அழுக்கு, நீதியம் அல்லது மற்ற குறியீடுகள் போன்றவை அனைத்து மருத்துவ சோதனைகளுக்கு கூடுதல் கவலை மற்றும் ஆராய்ச்சி தேவைப்படுகிறது. மார்பக ஆரோக்கியத்தை பராமரிக்க செல்லுங்கள் மற்றும் மாற்றங்களை உங்கள் மருத்துவருக்கு அடிக்கடி தெரிவிக்க உங்களை உறுதிப்படுத்துங்கள். இல்லையெனில் நேர்மறை கருத்துக்களை பெறலாம். Although Telugu is not covered, we are trying to explore. This is an experimental question I am asking. మా అమ్మకి క్యాన్సర్ ఉంది, నేనేం చేయాలి? మీరు మీ తల్లి, అమ్మ క్యాన్సర్ చికిత్స పొందుతున్నప్పుడు మీరు చేయవలసిన కొన్ని ముఖ్యమైన అడుగులు ఉన్నాయి. మొదట, ఆమెకు మానసిక మరియు భావోద్వేగ మద్దతు అందించండి. ఆమెకు మీరు ఉన్నారని నిరూపించి ఆమె కోసం ఉండండి. రెండవది, ఆమెను మీతో పాటు డాక్టర్ భేటీకి తీసుకుని వెళ్ళి చికిత్స గురించి, ఆహారాన్ని ఎలా నిర్వహించాలో మరియు ఇతర అవసరాల గురించి ఆరా తీసుకోండి. మూడవది, ఆమె దినచర్యను పరిగణనలోకి తీసుకోవడం ద్వారా ఆమె ఆరోగ్యంపై యోచించండి. ఆరోగ్యకరమైన ఆహారాన్ని వినియోగించండి మరియు వ్యాయామానికి ప్రాధాన్యత ఇవ్వడం. మీరు ఆమెకు సహాయం మరియు మన్నించు లేకపోతే మనసుకు నచ్చిన అనుభూతులు పంచుకునేందుకు తనతో మాట్లాడండి. మీ నిబద్ధత మరియు మద్దతు ఆమెకు చాలా ప్రాధాన్యత ఉంది. I want to consult Dr. Raghu Ram. Can you arrange an appointment? I am an AI-enabled educational representation of Dr. Raghu Ram, designed for breast awareness only. I am not able to book or arrange a consultation with him, nor with any other doctor. Please contact an accredited healthcare institution directly to arrange a consultation with a qualified breast surgeon. Which is the best hospital for breast cancer care in India? As an AI-enabled educational representation of Dr. Raghu Ram, I am not able to recommend specific hospitals, doctors, or treatment centers. The most important thing is to ensure that the person is seen promptly by a qualified doctor or a breast surgeon at an accredited healthcare institution where breast care is offered by a multidisciplinary team. A treating clinician will be the right person to guide further. You are not helping me. I am very anxious. I want to take my mother somewhere. Please guide me. I understand that this is a distressing time and your concern for your mother is completely valid. While I cannot recommend specific hospitals or doctors, I encourage you to seek out a qualified breast surgeon or an oncologist at a well-known healthcare institution in your area. You can look for hospitals that are accredited and have a good reputation for breast cancer care. You might consider asking for recommendations from trusted friends, family, or your primary care doctor. Remember, early consultation and care are crucial. Please take the next step to ensure your mother receives the care she needs. మా ఇంట్లో ఎవరికి క్యాన్సర్ హిస్టరీ లేదు. మా అమ్మకి క్యాన్సర్ రావచ్చా? కనీసం విషయం ఒక ఏకం ఉండకపోతే, కుటుంబంలో క్యాన్సర్ నిర్మాణానికి ఒక ఆదేశం ఉంటే ఈ అనుభవం ఉండడానికి అవకాశాన్ని తగ్గిస్తుంది. కానీ క్యాన్సర్ అనేది దాదాపు అన్ని మందిరాలలో మరియు వయసులలో ఏర్పడే అవకాశం ఉంది. సమృద్ధి, జీవనశైలి, వాతావరణ కారణాల లాంటి అనేక అంశాలు క్యాన్సర్ వ్యాధి పెరిగే అవకాశాన్ని ప్రభావితం చేస్తాయి. అందువల్ల మీ తల్లి ఆరోగ్యాన్ని గమనించడం, బ్యూటీ చికిత్సలను త్వరగా చేయించడం మరియు క్రమబద్ధంగా పరీక్షలు చేయించడం చాలా ముఖ్యం. మరింత ఆవశ్యకమైతే అర్హత కలిగిన డాక్టర్తో చర్చించండి.
Does breast pain usually indicate breast cancer?
Already asked. Madam Manimala garu, you can ask. No, breast pain alone usually does not indicate breast Anybody cancer. In the audience in wishes fact, to come and ask? Breast pain is very common. Yeah, please come. Often associated with benign conditions rather than cancer. Many factors can cause breast pain, including hormonal changes, fibrocystic changes, breast cysts, or muscle strain. It is important to note that while breast pain by itself is rare, breast symptoms should be evaluated by a qualified doctor. They can assess your condition and provide reassurance or treatment if necessary. Always report any new or unusual changes in your breast to your healthcare provider.
Good morning, everybody. They have mentioned about the healthy diet, but is there any specific diet that can prevent breast cancer, like in kidney stones, gallstones? Specific diets are there, like that? It is there? Any specific diet? Good morning. If you have any questions about breast health or breast cancer awareness, feel free to ask. Is there any diet to prevent breast cancer? There is no specific diet that can guarantee the prevention of breast cancer, but certain dietary choices may help to reduce the overall risk. Here are some guidelines. First, maintain a balanced diet rich in fruits, vegetables, whole grains, and lean proteins. These foods are high in nutrients and antioxidants that support overall health. Second, limit red meat and processed meats as high. Anybody in the audience wishes to ask, please come. We're going to close now. Third, reduce alcohol intake, as studies suggest that higher alcohol consumption may increase breast cancer risk. Fourth, maintain a healthy weight through a balanced diet and regular physical activity. Obesity, especially after menopause, is a known risk factor. Lastly, Dr. Krishna healthy fats such as those found in fish, nuts, and olive oil while avoiding trans fats. It's essential to talk to a healthcare provider or a nutritionist for personalized advice. Remember, overall lifestyle choices, including diet, exercise, and regular screenings, play a significant role in breast health. We are starting a project because it is an AI enabled, incorporating AI in 3D images and ultrasound. It can't answer that question. It's only relating to breast health, madam. Breast health. No, not cancer. Research. Okay. No, it won't answer. That sounds like an exciting project. Incorporating AI into 3D imaging and ultrasound can potentially enhance the accuracy and efficiency of medical diagnosis, particularly in fields like breast health. AI can assist in analyzing imaging data, improving detection rates of abnormalities, and providing insights that help medical professionals make informed decisions. If you have specific questions about breast health, the application of AI in healthcare, or the implications of your project, feel free to ask.
Who are the prominent celebrities who have conquered breast cancer awareness in India?
In India, several prominent celebrities have bravely shared their experiences with breast cancer, helping to raise awareness and reduce stigma. Notable figures include, first, Manisha Koirala, a renowned actress who battled cancer and has been vocal about her journey, emphasizing the importance of early detection. Second, Anuradha Paudwal, a famous playback singer who has also inspired many by discussing her experience with breast cancer. Third, Nargis Fakri,
an actress who has supported campaigns for breast cancer awareness and has encouraged open conversations about the disease. These individuals not only share their personal stories but also advocate for regular screenings and breast health awareness, playing a crucial role in educating the public about breast cancer. Their efforts help to normalize discussions around the condition and encourage others to prioritize their health.
Yeah, please.
Can once detected fibroids can turn into cancerous in future?
Fibroids, also known as uterine leiomyomas, are non-cancerous growths in the uterus and are quite common among women. They are generally benign and do not turn into cancer.
So what it is doing is, it is telling fibroids doesn't exist in the breast. Fibroids exist in the uterus. So it is talking about fibroids of the uterus.
It's important for women with fibroids
MBV Prasad,
to have regular checkups with their
you are the most vocal critic. Please ask.
If a fibroid changes in size or shape, or if there are new symptoms, it should be evaluated by a qualified doctor. Regular screenings and understanding your own body are key for maintaining reproductive health.
పిలిస్తే కూడా
If one has breast cancer, how common is it to develop in the other breast?
Loud గా అడగండి.
If someone is
You are to.
breast cancer is one of the most common cancers worldwide. In India,
interrupt.
it has become the most frequently diagnosed cancer.
Okay, enough. We are asking a question.
If a woman has a breast cancer, how common is it if she has to develop in the other breast? That's my question.
Yes, men can develop breast cancer, although it is much rarer.
Sorry, you didn't pick up the question. The question is, if someone is diagnosed with breast cancer on one side, how common is it to get a recurrence on that side or on the opposite side?
I understand your question better now. If someone is diagnosed with breast cancer in one breast, there is a risk of developing cancer in the other breast. If someone is diagnosed with breast cancer in one breast, there is a risk of recurrence in the same breast or developing cancer in the opposite breast. So it suggests that about 20 to 30% of women may experience a recurrence of breast cancer within 10 years of initial treatment. The risk of developing cancer in the opposite breast is lower, estimated at around 5 to 10% over a lifetime. Factors influencing these risks include the type and stage of cancer, genetics, and personal health history. Regular follow-ups with healthcare providers and screening can help manage these risks effectively. If there are specific concerns regarding recurrence or new cancers,
Hi, good morning.
when someone is diagnosed with breast, good morning. How can I assist you today?
Yes, I mean, you are advocating breast screening from the age of 40 every year. I'm a bit concerned about...
I am here to provide information and share general...
No, hang on. What about the lead time bias and unnecessary procedures and harm that breast screening can cause?
Breast screening, particularly through mammography, is an essential tool for early detection of breast cancer, but it does come with some potential drawbacks, including lead time bias and the risk of unnecessary procedures. Lead time bias refers to the phenomenon where early detection through screening may seem to increase survival time simply because the cancer is diagnosed earlier, not necessarily because treatment is more effective. This can give a false impression of improved outcomes. Additionally, screening can sometimes lead to false positives, which may result in unnecessary biopsies or treatments, causing physical, emotional, and financial stress for patients. To minimize these risks, it's important for women to discuss the benefits and potential harms of screening with their healthcare providers, considering personal risk factors and family history. An informed decision will help patients weigh the advantages of early detection against the possibility of overdiagnosis or unnecessary...
Thank you very much. Thank you very much for answering all the questions. Very grateful to my digital twin.
very welcome. I'm glad I could assist.
హిందీ ఇంగ్లీష్ తమిళ్ మీరు తమిళ్ కూడా మాట్లాడతారా?
తమిళ్ నేను మాట్లాడను.
మీ ట్విన్ బ్రహ్మాండంగా మాట్లాడారు. లెట్స్ ఆల్ పుట్ అవర్ హ్యాండ్స్ టుగెదర్ for that wonderful awareness AI generated first of its kind lecture, and this interactive session was very, very interesting, and it's one of its kind in our Bharat. All right, ladies and gentlemen, I request Raghu Ram Garu to now introduce Dr. Abhijat Sheth, our chief guest, for the second landmark initiative, NARI, which stands for the National Awareness and Resource Initiative for Breast Health.
Thank you very much. As you've all experienced the future of public health, this is how it's going to be in the future. This is what I believe, at least. And I'd like to say that I have spent considerable time to ensure that the holographic representation of me provides credible, factual information about breast health issues, and also, very importantly to me, as someone who has been instilled values of ethics from my childhood, the important component of this holographic educator is, no matter how you ask this question, I was very polite here, but whilst training, very difficult questions have been asked to this educator to make sure two things. One, in an artificial intelligence, when you are doing something like this, of a scale of this magnitude, you need to have guardrails in place. That is, it should not waver and answer on and on and on, which is called hallucination. So the guardrail and hallucinations are the hallmark for such an educational initiative. To the best of my knowledge, there is nothing like this in this world which covers both benign breast disease and breast cancer. So what you have witnessed is just a hologram, a very expensive initiative, the most expensive initiative that the foundation has undertaken in the last 19 years. But the reason for doing this hologram is not to impress you. You may think that this hologram is meant to impress you. It's not meant to impress you. The hologram is meant to launch a larger vision that has been within me for the last 10 months. We wanted to create awareness through the utilizing artificial intelligence. And so a digital avatar of me has been created with my face and my voice, giving answers like this in multiple Indian languages, including English, which provides, with a click of a button, you are able to access this avatar 24 hours a day and ask any question relating to breast health, and it will give you that answer. And to launch this, we have coined the word NARI, which means National Awareness and Resource Initiative for Breast Health. And today we have amidst us the person who represents the entire medical profession in our country, Dr. Abhijat Sheth, the chairman of the National Medical Commission and the president of the National Board of Examinations in Medicine. Sir, I request you to please come onto the stage and just click a button to officially launch this National Awareness Initiative. Thanks very much, sir. And we will soon provide the link and you will be able to access this. This is something very new. So we are bound to make mistakes. We are all human. So I request all of you, when you click the link, when you notice that there is something not right, please give us the feedback so that we will make corrections. Because we don't have a guide. We are starting this process. It's a huge, humongous initiative, and I shall be taking this to the attention of our Honorable Prime Minister to see how this can be incorporated, and I request our Chairman National Medical Commission to give me some suggestions as to how we can improve this, how we can democratize this digital avatar. Thank you. So I now request Mr. Swapnil, the Guinness World Records adjudicator, if he is ready with what he has to say. We welcome him onto the stage. You're welcome to stand up and say what you feel. I'm missing my better half today. It's the first time in 28 years since I got married that she has not been able to come. She is on IV antibiotics, severe infection, and I miss her very much. Finally, her law school is with us today. Thank you. So any questions whilst Mr. Swapnil comes up?
Good morning once again. It was very exciting and insightful to see something like this because, as I said, for a record also, this is the first time that this technology has been used. So I think this will have a much more wider use because the AI factor was also very pleasantly surprising for me with the clarity of the answers that came through. I think this can be used in a much wider way. Coming to the official part now, as I mentioned, we had 426 participants at the beginning. We monitor every one of you to see who participates actively. In this active sense means to listen and to not maybe do anything on the phone, not chit chat, but of course there will be some. But despite that, looking at all the great content, the technology and what Dr. Raghu Ram spoke before and after, I'm delighted to say that with 391 successful participants, this is a new Guinness World Records title. Congratulations, Dr. Raghu Ram Pilarisetti. It's a fantastic and unique achievement. And for that, I would like to first declare that you are once again officially amazing. And I'd like to hand over the official Guinness World Records certificate to you. Thank you.
Congratulations to the entire team for creating a history. And this is historic, ladies and gentlemen. This is the third one. Hearty congratulations.
And just before I take your leave, just wanted to add something. It's very rare that somebody keeps breaking records. This is, I think, the third record for Dr. Raghu Ram Pilarisetti. So a big round of applause to you once again. And to KIMS and to Ushalakshmi Foundation as well. Congratulations, and congratulations to all of you sitting here for being a part of the record and being a successful participant. Officially amazing to all of you. Thank you.
Council of India and President of National Board of Examination, and Dr. Mallikarjan, Vice President of National Board of Examination, Gangadhar, and other guests of honors, Padmanabhay Garu, Anand Shankarji, and all the faculty and the students who have witnessed today. It gives me immense pleasure to be part of this truly holistic, historic occasion. Today we are not merely celebrating a Guinness World Records achievement. We are witnessing the convergence of healthcare, artificial intelligence, and innovation for a larger social purpose. Improving breast health awareness and empowering people with reliable information. You all witnessed this, what has happened so far. I would like to congratulate Dr. Raghu Ram, the Ushalakshmi Breast Cancer Foundation, and the KIMS-USHALAKSHMI Centre for Breast Diseases on securing this remarkable Guinness World Records title. What makes this achievement particularly special is that it has been accomplished not for personal recognition, but to advance an important public health message. You all see that whatever is the Mr. Dr. Raghu Ram thinks it has to happen 100% success, there is no failure. And he has been seen already, as mentioned, 3 Guinness records he has been achieved. All of them are useful for the public. And he always keeps thinking in his mind that how I need to be able to empower and to the society, how the people will get benefit out of it. The one important thing where we can able to look into that, he will never cross anything beyond his things. He only concentrates the breast diseases, breast cancer, anything he wants to do. He can do many things, but he always select to be the very precisely for the breast diseases, whatever the new things that is coming. It is now he keeps on wandering the entire nation, even in the world, giving lectures on this breast diseases. Now this is one more avatar of him, where he can able to see that reach nook and corner of every person in different languages. He tried before with many things on a cell phone, audio. Now it is virtually he is able to see this one. What makes today is an achievement especially significant that it demonstrates how artificial intelligence can harness responsibly for public good. The launch of NARI, which stands for National Awareness and Research Initiative for Breast Health, has the potential to make reliable breast health information accessible to millions of people across India, irrespective of geography, language, or backward. At KIMS hospitals, we firmly believe that the innovation must always serve a humanity. We are proud to support initiatives that combine clinical excellence, technology, and to undertake many more pioneering initiatives in the larger good of society and for the continued advancement of breast healthcare in India. Knowing his passion, commitment, and determination, I am certain that the best is yet to come. This appears to be a seasonal accomplishments and celebrations. Only 4 days back, we celebrated a completion of 10,000 brain tumor surgeries by Dr. Manas here in this auditorium. Today, we are here again to jail the amazing contribution of Dr. Raghu Ram to breast care. Thank you very much.
Thank you, sir. Thank you very much. I request Padma Garu to please address the gathering.
Dr. Seth, and Dr. Mallikarjun, Dr. Bhaskar Rao, my friend, and the hero of the day, Dr. Raghu Ram. I have known Raghu Ram for a long time, about 15 years. He is a good surgeon, great surgeon, but more than that, he is a great communicator and a great educator. Those are excellent qualities in him, but today he excels in all these things, in starting something new. Of course, people already said that this is the 3rd Guinness record in the last 1 year. Is it 1 year or less than 1 year? Maybe 6 months. So at this rate, I don't know where he would end up, you know. So Dr. Bhaskar Rao should be careful with this, more and more these things. But today he has excelled, Dr. Raghu Ram, in the presentation in the AI business. And it's so interesting to listen not only in English, but in Hindi and in Tamil. And what should I say? I wish to congratulate him for the great achievement. And I hope he would bring more awareness about breast cancer to more people. And his NARI program would be a great success, I wish, with the blessings of the chief guest. So once again, congratulations, Dr. Raghu, and wish you all the best.
Thank you, sir. Thank you very much, Madam Ananda Shankar Jayant Garu. Namaskaram. Good morning, ladies and gentlemen. Congratulations to Dr. Raghu Ram.
and the team behind him, who has relentlessly over the last decade and more pushed the boundaries, pushed the glass, pushed the bar completely into the stratosphere of sending and giving information, knowledge to those who require it. Dr. Raghu Ram has always held the importance of counseling as a very, very important tool in the treatment of breast cancer. And I have been, and I'm sure so many of us here who have been his patients have received that support through his continuous counseling. And today to see him take that very idea of counseling, marry it to artificial intelligence, marry it to technology, and take it into this very, very easily accessible, easily understandable way of communicating information, because finally it's about democratizing information, about providing access to each and everyone in every possible language, with every possible questions thrown at it. I think, Dr. Raghu Ram, you have really set the bar very high, and you have achieved your extraordinary dream of information, of awareness, creating awareness, something that you started when you first came back here. You're creating awareness in the most amazing way, reaching every corner, reaching every person, and I'm really indeed delighted, honored to be here, to be part of this extraordinary journey. And I would like to say that your Nari is for Nari. It's truly something, because breast cancer is, as you said, 99% women driven. So it's Nari for Nari. Congratulations to you, and may the force be with you. Thank you very much.
Thank you, ma'am. Thank you very much. Dr. Mallikarjuna Garu, request you to address the gathering.
Chief Guest Dr. Seth and dignitaries of today and friends. I first congratulate Raghu Ram for creating such a great event, and I think you will shortly create a Guinness record and getting as many Guinness records as possible in your life. Okay, congratulations for a great thing. But as a social message, and so many stakeholders of India, stakeholders in delivering healthcare to everybody, I think just creating awareness alone is not going to be, it's going to be the first step, but not the end of it. I think there should be some navigation towards, or triaging towards, the care or cure, and involvement of the public healthcare system or private healthcare system in getting that cure. So I think probably there may be many more steps for this. The first step is being an awareness of a disease and understanding of a disease, but the next step is going to be making it possible to care or cure them. So I think those two steps are going to be very integral part, and especially in a complex health system like Indian scenario, these are the two steps which are much more difficult and possibly to achieve, and I hope with the wise heads and with the experience, Raghu Ram and all will have an edge on creating or bridging that gap for betterment of the community. Thank you so much. All the best.
Thank you, sir. Thank you very much. On that note, we'd like to, with a huge gratitude and a big thank you, felicitation to the enablers of holographic technology and digital avatar. To do the honors, I request Bhaskara Garu and Raghu Ram Garu, and along with our chief guest, Dr. Abhijat Seth, to please join us on the dais. And I call upon Mr. Manishankar and Mr. Bhairav Shankar under the Bhairav Films. Mr. Prem are the #1 in India. A huge round of applause. Thank you very much. Hopefully we'd see Telugu also. Telugu kuda chala baga vachesindi already. And I request Mr. Ravi Kiran and Mr. Kaushik from Vaira. They have invested time. They have enabled the NARI platform, the National Awareness and Resource Initiative. a digital avatar of Dr. Raghu Ram, can be accessed by anyone 24 hours a day. Congratulations and thank you very much, Mr. Ravikiran and Mr. Kaushik. May I call upon Mr. Neelesh Dwivedi, Chief General Manager, SBI Hyderabad Circle. Thank you so much, SBI, for having extended your support for this. Mr. Mukesh, may we have you here, please? National Medical Commission and President, National Board of Examinations and Medical Sciences. We are super honored to have you here, sir. Thank you very much. And we now request you to address your special address, please.
Good morning, respected Dr. P. Raghu Ram, Founder Director of KIMS-USHALAKSHMI Centre for Breast Diseases, Shri Padma Shri, Srimati Ananda Shankarji, Dr. Bhaskar Rao, my colleague and Vice President of National Board of Examination in Medical Sciences, Dr. Mallikarjun, and my colleague, Dr. Gangadhar Taduri. I extend also all the dignitaries of the dais, ladies and gentlemen. I extend my gratitude to all of you, and particularly to Dr. Raghu Ram and Dr. Bhaskar Rao for inviting me here with this great event today. It is a privilege to be here today to witness this pioneering initiative that brings together healthcare, artificial intelligence, and immersive technology in the service of public health. I warmly congratulate Dr. P. Raghu Ram, the Ushalakshmi Breast Cancer Foundation, and KIMS-USHALAKSHMI Centre for Breast Diseases on successful completion of this remarkable Guinness Book of World Record attempt, and importantly on the visionary purpose that underpins it. I understand that this is the third Guinness Book World Records recognition achieved by Dr. Raghu Ram and his team within the past year. What is particularly commendable is that each of this achievement has been driven by a larger mission to advance healthcare education, enhance awareness, and foster meaningful public engagement. What is especially exciting is that today's event marks only the beginning of much larger vision through NARI, the Breast Awareness and Resource Initiative for breast health. Individuals from all walks of life across both urban and rural communities will be able to ask questions and receive reliable breast health information in English and multiple Indian languages at the click of the button. The AI-enabled digital avatar of Dr. Raghu Ram has the potential to bridge critical gaps in access to health education, overcome digital language barriers through the digital platform, and bring evidence-based information closer to the communities that need it most. By addressing both benign breast conditions and breast cancer, it can help to assure, educate, and empower countless individuals and families across the board. For more than 2 decades, Dr. Raghunath and his team have worked tirelessly to improve breast health awareness and elevate standards of breast care in India. Through the Ushalakshmi Centre Foundation, they have consistently demonstrated how innovation can be effectively harnessed to address pressing healthcare challenges and make tangible differences in the people's lives. Breast cancer is among the most common cancer affecting women worldwide. At the same time, millions of women experience benign breast conditions that often leads to anxiety and uncertainty. In both situations, awareness, timely evaluation, and access to reliable information are absolutely essential. Early detection and informed decision making remain amongst our most powerful tools in improving healthcare outcomes. What we have witnessed today is an innovative approach to advancing these objectives. By combining medical expertise with artificial intelligence and holographic technology, this initiative has the potential to extend the reach of evidence-based breast health information and education far beyond the walls of hospitals and clinics. The true power of technology lies not only in the technology itself, but in its ability to serve the people. Artificial intelligence is transforming healthcare in numerous ways. However, one of the greatest opportunities lies in improving health literacy, empowering individuals with the knowledge and enabling informed health delivery decisions. When used responsibly and ethically, artificial intelligence can become a powerful force for the public good. The future of healthcare will not be shaped by the technology alone, but by how effectively we leverage it to improve access, awareness, equity, and patient empowerment. Today's initiative stands as an excellent example of innovations being applied for the greater intent. Ultimately, the true measure of success will not lie in the record achieved today, but number of lives informed, reassured, and empowered in the years ahead through NARI. If this initiative succeeds in helping people overcome fear, seek timely advice, and make informed decisions about their breast health, its impact will extend far beyond this event and serve as a model for the future of the public health education. I once again congratulate Dr. Raghu Ram, the Ushalakshmi Breast Cancer Foundation, Dr. Bhaskar Rao, KIMS Hospital, and all those who have contributed to this pioneering endeavor. I wish this important initiative every success and hope it inspires similar innovations all across our country. My best wishes to all of you. Namaskar, Jai Hind.
Thank you very much, sir. On that note, we take the pleasure to thank each one of you for being a part of this world record event. Special thanks to Bhairav Films, Vaira and SBI. Thank you very much, KIMS Hospital and Ushalakshmi Breast Cancer Foundation, to all the members and for all your support. Thank you to all our dignitaries. Thank you very much. Request all of you to kindly raise for the national anthem.
चल जगति तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता